Hey, happy Friday, Maternity Massage Collective peeps. Sorry, it took me a couple minutes to get on today. I think Pamela will be heading in any moment. And once again, this is going to be a really big topic, and I'm excited to talk about it. So today we're going to be talking about induction massage and the ethics of induction massage. So I am going to try not to jump too far ahead too fast until Pamela can get on, but yeah, there's going to be lots to say here. And the last time we touched on this topic, yeah, there was, I think, probably the most comments that we've ever had. So I'm excited to get into it and to share my perspective and what I've done for quite a few years, and things to consider, and maybe some misconceptions that I think are common, not just amongst our clients but also amongst us as practitioners. So it will be good to dive into all of that. Let me see if Pamela is on yet, if I can send her an invite. Let's see. Yeah, so I'm curious how many of you actively offer induction massage as part of your offerings in your practice. How many of you have decided consciously not to? How many of you might be on the fence and curious about, how do I do that? What would it look like? What does it look like in practice? How do I communicate things? So hopefully we're going to be able to touch on the majority of those things today. And Pamela and I both offer it in our practices, and I think with slightly different parameters. So it'll be good to hear from two different people who have implemented it in slightly different variations. But yeah, I've been offering induction massage for more than 10 years. And I can just say right off the bat that I really feel like offering an induction massage is much more a response to the cultural umbrella of what I can clearly see is causing stress to my clients, and that this actually serves a very compassionate purpose for many of them. But I will also say that in a perfect world, and in my personal view, I would prefer not to offer this service at all. I wish it wasn't even necessary. I wish that mothers and babies were left to timelines that made sense for them, and that there wasn't a lot of pressure and high stakes involved in when exactly, a low risk pregnancy unfolded. So I just wanted to kind of start with that caveat. I can see Pamela is on. Pam, I don't know. Oh, there it is. Okay, I was gonna say I didn't see the request. It says adding, slowly blinking. Yay.
Hi.
Hi.
So I don't know. I know that you've been talking for a minute because I can tell, but didn't tell me that you were live yet. It came very
Oh,
slow.
interesting. Well, I did get on a tiny bit. It took me a little bit to get on.
Yeah, that's okay. Yeah.
Oh, good. And I was just gonna say, and your volume was a little low, but I could hear you, and then it just popped back on. So that's great. I can
Okay.
hear you
Can you
great.
hear me?
Yes. I mean, it's
Great.
always the tech stuff, right?
Yeah. Yeah, well.
I haven't blabbed too much though yet. I was just kind of setting the scene of just like being curious, what other people are doing in their practices and what their stances are and all
Yeah.
of that. And also
Sure.
just sort of sharing, the last time we touched on this topic, like it feels like a controversial topic, which is great, like let's talk about all of the angles.
Yeah.
And I think that there are some slight differences how like you and I have implemented it. So I think it could be cool for people to hear, what it looks like in real life and in practice.
Yeah.
Yeah, and then the only other thing that I had just said, which I mean, I'm assuming you probably agree, is that, in a perfect world, we wouldn't even need to offer this service, right?
Absolutely. Yeah.
Like
Yeah, I
I wish
do.
we didn't need to.
Yeah. Yeah, no, I feel I was gonna make sure that we do talk about, sorry, I'm getting comfortable.
No, please. Yeah.
Like getting cozy. Yeah, I feel like it's really important that we talk about why this work is so important and why it's necessary and what's happening in the reality of mamas and babies and in the birth world. Yeah. Yeah.
Yeah, and I touched on it too, that sometimes like this can be a compassionate and helpful response to a larger cultural context that has nothing to do with the actual like
Yeah.
biology of mothers and babies, right?
Sure. Absolutely. Yeah. There's such a huge push. I mean, just about every mama I see at like 38 weeks is talking about their doctors, wanting to schedule them for their induction.
Yeah.
Um, I mean, if you ever had what do we call this? Not a pandemic, but a epidemic of inductions, this is it. It's really bad. Yeah.
Yeah, it's really bad, and there are very real repercussions to this, right? And I think that,
Mhm.
for the massage therapists who might be new to the birth world, I think that we should really like flush that out for them of like, you know, some people might not even know, okay, we're talking about like clients getting told that they need to get induced at 39 weeks. What does that even mean, right? So when maybe we can back up for a minute and just like define due dates for them, right? Do you want to
Sure.
touch on that?
Yeah. Well, due dates have, we've been calling them guest dates, right? For a while because most babies, I think it's like 3% actually come on their due date. Sorry, what was it? My brain just flew
just
away.
just just defining what a due date is, because that way like
Yeah.
when we start talking about people wanting to induce at 39 weeks, they
Yeah.
have some kind of a reference for it, like is that soon, is that late, is that fair to mamas and babies?
Yeah. Yeah. So in the birth world, so 40 weeks is like we think of that as full term gestation,
Mhm.
when babies are ripe. And but in like the midwifery circle, you would be able to deliver 2 weeks before that or 2 weeks after that for a home birth, right?
Mhm.
But what's happening in the birth world with obstetrics is wanting to bring mamas in sooner, not let them go later because of the risk of, you know, we hear big babies all the time, placenta abruptions, calcification of the uterus, all these
Mhm.
different, of the placenta, all these different terms that get thrown around. But when the reality is that that's a very, very small percentage of people that have those risks. Some people do have risks and need to, be managed a little more
Sure,
closely.
or they might want to, or they might opt to, right? Because so much
Yeah.
of this is that like it's getting pushed onto women without there being a full understanding of what the consequences of forcing your body to do something that it's not ready to do,
Yeah.
right? Because
Yeah. This is the
there's always
problem.
going to be a downstream effect of that. And so my big issue is, number one, not only are we not giving especially first time moms a fair chance of actually gestating their babies to a place of like hormonal completion, right? So that like, because
Yeah.
it's the baby's lungs, like the final touch is put on them, and then there is a signaling from the baby's body to the mother's body that I am ready, and then they start this loop, this cascade of hormones amongst each other, this conversation that signals that the body is ready. And if we start essentially like
Well,
ejecting the baby
we're
before that,
disrupting
yeah,
biology in the very beginning.
are. And
Yeah.
there are consequences to that. And my issue is that those are not always clearly stated to brand new moms. Um, so yeah, so when we're talking about due dates, that is 40 weeks from someone's last menstrual period. It's not perfect science, right? Because different lengths of menstrual periods means that conception could happen like within a range, right? If somebody has a 21-day cycle, they might have gotten pregnant, you know, a week, sometimes almost 2 weeks sooner than somebody who has like a 35-day cycle, for example. So it's not
Exactly.
perfect science. But they hold this date like it is this like weighted gold standard, immovable
Right.
date.
Right.
And it has real consequences. And you already touched on this a little bit about midwives, of So midwives are legally allowed to attend births that happen anywhere between 37 and 42 weeks. And if it happens 36 weeks and 6 days or 42 weeks and 1 day, they legally have to transfer to the hospital, right?
Yeah.
Even if you're low risk, even if your baby is passing all the non-stress tests, even if there's no true danger here, this is just
It's a
women
window.
and babies, yeah, getting caught in like a logistical parameters that really is not necessarily tailored to them.
Yeah.
Yeah. So I think that this is important too. I know we haven't really talked about massage yet, but we're getting there,
I
right?
know, I know. Yeah, because I really have to say, I was thinking about this before. It's like um, this management of women's bodies and them going into labor and disrupting that pattern of them allowing the body and trusting the body to naturally go into labor on its own is also taking away mom's confidence that her body can do this on its own. And it absolutely can, and it absolutely will do it on its own if it's left alone, right?
Yeah,
So you're undermining her confidence as a new mom, I think, from the very, very beginning. And that has bigger environmental, social, economical, all these impacts, political impacts. I mean, this is far reaching. We're not just talking about, oh, it's no big deal. This is a big deal.
I agree with you. I agree with you, which is, yeah, I feel very strongly that offering this service makes the most sense given the cultural climate. But again, like if all of these things weren't at play, all of these political things, all of these parameters, all of these, bypassing of true informed consent, would we
Hmm.
actually need this service? My answer is no, I don't think so.
No, you wouldn't need it.
Yeah.
Yeah, yeah,
Yeah. So yeah, we'll get into exactly like what is involved in induction massage and what it looks like in the treatment room and how we communicate about that. But I do think like having this conversation about why would we even think about doing that is super important.
yeah.
Um, and yeah, just going back, especially to first time moms, so that, therapists who might be new to this, like really know what's at stake. If your client goes in for a medical induction, whether that's with Cervidil or a Foley balloon or Pitocin or whatever it looks like, any kind of forced induction in that way, if they're a first time mom, their chances of having a cesarean go up 50%. Okay, so that's huge. And I know there might be some like people don't always understand this, but there are also some major things that get lost in a cesarean birth, right?
Oh,
And
yeah, yeah,
yeah, and so there, it is a huge interruption. It is a major surgery. There are risks to the baby. There are risks to the mother. There are interruptions, some more significant than others in their like immediate postpartum bonding time. There
sure.
can be bigger hurdles for breastfeeding. Like there are a lot of things that come along with a C-section.
And we're setting her up for consequently potentially having subsequent cesarean births, depending on where she is in the country and what providers she has available to her and how much she's able to advocate for herself. Yeah, there's the downfall or yes, this like just this cascade of things that can happen.
Yeah. Yeah. And having, just on a personal note, having had a cesarean for my first and having had, a home birth, vaginal birth for my second, the healing is vastly different. That postpartum time was vastly different. It was much easier. Um, and not just physically to heal from, but also to just connect with my baby. You're not on painkillers. You're not recovering from a major surgery. Yeah, I mean, I did quite well, all things considering, and like my breastfeeding relationship with my firstborn was not impacted, but um, I feel like that was lucky in a lot of ways.
Yeah, I mean, just being able to pick up your baby and hold your baby, over your belly is a big deal for
It's a
a
big deal.
mama. Yeah, so
Yeah.
I
So I'm
know.
glad that we're really fleshing this out because like when we know what's at stake, then we can better attune to what our clients are coming in with, right? Because you might have a client at the very end of her pregnancy, and maybe she's just been, maybe you've seen her all along, and she's been like relatively, you know, a calm and happy person, and she comes at the end and her stress level is like maxed when she's saying that, like, yeah, they've written me in for an induction, and if I, you know, if things don't go exactly, check all these perfect boxes, then I'm headed for a C-section. For some women, they're going to be able to roll with that and not have it affect their nervous system or their plans to the same degree as others. For some clients, it can be absolutely devastating, especially if they have built a relationship with their midwives and they're having to go, yeah.
Yes. So Margaret is watching and made a comment that her friend was induced, and 4 hours after her induction started, the baby's heart rate dropped. And I didn't read the rest of it, but this is very common, you know, that as soon as mom has either Pitocin or an epidural, baby's heart rate will drop. And then this is what we talk about with that cascade of intervention. Then they'll give her mom medicine to get baby's blood pressure back up, heart rate back up. And it just leads to a whole thing, you know, that can quickly spiral into a cesarean. Yeah.
Yeah, and yeah, what what you're describing is like textbook. This happens all the time, right? And so when we're talking about Pitocin-induced contractions, those are much more intense than oxytocin-produced contractions. Oxytocin is the hormone that our bodies make naturally that, you know, cause the uterus to contract. And Pitocin, you know, we say it's like, oh, it's just synthetic oxytocin. It is not. It's like oxytocin on steroids. It's like, sometimes it feels like there's like a freight train moving through your body, right? And so it's really understandable why a baby might be like, whoa, I'm not doing so well with this, you know?
Yeah. And I've seen them, you know, put someone on Pitocin and turn up Pitocin every half hour, every 30 minutes. They're doubling up the numbers, you know, it goes up by
Right.
2. So, you know, pretty quickly, if someone wasn't in labor and you do that to them, they are literally climbing the wall. I've seen it
Yeah,
happen. Like
I've
they
seen it
can't
happen
cope
too.
with that.
Well,
Yeah.
that's why it's very, very rare for you to have a post-Pitocin induction without also having an epidural. And I've seen clients who were able to withstand it, and it's some of like the most heroic um, endurance that I have ever witnessed, because those contractions are so brutal. And you're right, it makes you just like want to crawl out of your own skin. So it's not unusual that that is also impacting baby. Like the strength of those forced contractions on a baby, they are way stronger than what, you know, an oxytocin produced contraction would otherwise be. And so it's
Right.
understandable that babies are not going to tolerate that well. Yeah, and then usually well, 50% of the time, right, it's going to lead to a cesarean for first time moms. It's slightly lower if for, you know, second or third, fourth time moms. Yeah. Was there
Yes.
anything else that
Yeah.
Mike was saying?
So let's see if I can find her. Yeah, she said had an, so that person had an emergency C-section. Um, mm,
Yeah, I'm
oh,
just
epidural migraines. Yeah, so epidural migraines happen as well, which is, you know, there's a little tiny air bubble in the blood vessels there, and just it can be in your shoulder, it can be in your back, it can be, you know, in your neck. They're just, yeah, it can be really excruciating.
and then how distracting is that from bonding with your brand new
Yeah.
baby? Yeah.
Yeah. So
Yeah, and I guess, you know, it might be worth noting too, just so that you are, all the massage therapists listening, is that an emergency cesarean, all that means is that it was not a planned cesarean. So
right.
most people, you know, most of your clients too, they won't know that it didn't mean that your baby was like eminently in danger.
Yeah.
The scenarios where it's like we have to get the baby out now and we have to go to C-section, those are called crash C-sections.
Yeah. I,
So, but it's sometimes it can be
oh,
important for you or for clients to know this, because sometimes clients walk away with a story of like, oh, my body really failed me, you know,
right.
we were in so much danger. They said that I had to have an emergency C-section, and it's like sometimes the semantics are confusing. It doesn't actually, an emergency C-section doesn't actually mean that there was like anything imminent. They just probably decided this will be, sometimes it is the best decision for the mom, sometimes it's the easiest decision for the doctor or the time frame, or you know, all the other things that play into it, but it is not the same thing as a crash C-section. So I think that that's important for therapists to
It definitely it is important to differentiate that. I also think that, I mean, every person going into labor and whoever their support person is should understand you're walking into a fear-based system, right? So the language is often, this is going to tell, they tell you things like, you know, if we don't do this now, this is going to happen or this could happen. And they're fear-based ideas that, you know, they're setting up this scenario that is going to happen if we do the medical interventions, likely. But again, had you had a natural, spontaneous labor and birth, these scenarios don't happen. So,
yeah,
yeah, it's really about educating yourself before you go into the birth. Yeah.
yeah, for sure. Yeah, because oftentimes, you know, they they will end up saving you from the things that they have caused in the first place, from the
Yeah.
unnecessary interventions that
Yeah,
were, yeah,
absolutely. And, you know, I think that we do often have to say as well, like, all of these things have their place, right? Like
of course,
cesarean
yeah,
births, there are times when a cesarean birth is absolutely necessary, and it is emergency, and it is crash necessary. Like those things do happen occasionally, but we're talking about like a 30-35% cesarean rate in the country
yeah, there's
that,
no justification for that. Yeah.
right. So, okay. So that being said, so let's talk about induction
Okay,
massage.
let's talk about induction massage.
Yeah,
Do
we're
you,
not passionate at all.
not at all. Yeah. Yeah. So I've decided to offer induction massage, and I feel really clear and good about it because of all of the things that we just discussed. I feel like it can be such a sanctuary for mothers who are in that, um, you know, right on the precipice of birth, with maybe lots of threats of like just feeling like this clock is ticking, right?
Yeah.
And so the induction work that we do, it's, the components of it are twofold. One is that we're doing a lot of nervous system sedation work, activating the parasympathetic nervous system. And then the other portion is that we're working very distinctly on some of the acupressure points that, you know, before that time are contraindicated. They bring energy very strongly downwards in the body, all of that. And I, after doing this, you know, offering this particular service for over 10 years, I can't even tell you which one is more effective. Is it just helping her body feel safe enough, right? Just that sedation, helping it feel safe enough to actually do the thing that it's on the verge of doing?
Yeah.
Or is it these induction points, right? And I don't believe that there's any kind of magic button, right, that's going
Mhm.
to start labor. But I do think that some of these points can um, be helpful, you know, and I think that it can be bio individual too. Like I'm sure you've seen, like, so I have clients whose babies respond to certain points more than others, and I'm like, oh, that's interesting. Like your
Yeah.
baby likes this point, you know.
Hmm. Yeah.
So yeah,
It also opens the door to have a conversation about other things they can do leading up to this like impending induction, right, of their birth. Um, you know, and like we've talked about this many times, but they have the opportunity with us to have real conversation where they don't with most other providers. You know, so talking about you know, encouraging them not to work right up to their due date. Like if there's any way possible to take that week before or 2 weeks or 3 weeks off and have some long lazy days where you're really bonding with your baby and going for a walk and having a bath, and you know those things will go a long way to not, you know, we, yeah, to not being just really uptight and stressed and working up to your due date.
100%. Yeah.
Yeah.
Um, yeah. And I think that so much of what we can provide in that attunement and that active listening and that, you know,
Hmm.
compassion can really go a long way, because a lot of, you know, the obstetric care, if they're receiving care inside of that model, it can really get reduced to just feeling like they're constantly passing little mini tests, you
Yeah.
know, and they're reducing them down to, which can be, it's stressful. It's totally
Hmm.
stressful.
Yeah.
Um, so, so that's what an induction massage can look like. You know, I think you said that you really do a lot of massage work kind of in between the points. Is that
Oh,
true?
yes. So I
Yeah,
do it's a pretty much a full body massage, includes the points, but I do a lot of tailbone work, coccyx,
yeah,
hip, yeah, hip
yeah,
alignment movement stuff,
yeah.
um, with some breath work. And then for induction massage, I also include a peri steam.
Oh, nice.
So yeah, yeah, I feel like that really helps.
Mm-hmm.
So peri steam hydrotherapy or yoni steam, V steam, just short 10 minutes and not super hot.
Yeah,
But um, the conception vessel is in the perineum. And so we're warming the perineum and that conception vessel and, potentially softening and, just getting her really relaxed. And it is, if you've never done a steam before, it's just very, very relaxing and nurturing.
super
Yeah.
relaxing. Yeah, agreed.
Yeah.
You know, when we're talking about the ethics of this too, I thought it might be helpful to distinguish between labor preparation work, like some of the things that we teach in
Yes.
our 4-day workshop, from the induction points, and just making sure that, you know, because like you're saying, like you can combine them into a session, but we also
Mhm.
want to be really clear of like what's involved in each service, so that if
Right.
someone wants one without the other, they can very clearly opt
Yeah.
into or out of that, right?
Yeah. Yeah, I do have so my services right now are broken into like up to 36 weeks, and then 36 weeks to 40 weeks is labor prep, and then at 40 weeks an induction massage. Yeah.
Nice. Yeah.
So that it does, yeah, I think that clients need to understand that as well, right? So there's a
Yeah.
difference between what we're doing in the treatment room. Hmm.
Yeah. So, because we offer those things as well, because I certainly have clients who, you know, starting at like 35 weeks might want to do some labor preparation work, which, like you said, is, you know, softening the pelvis, working on pelvic floor attachments, working on adductor mobility, yeah, sacral attachments, breath work,
Yeah.
being able to mentally let go, right? All of those things are great preparation for labor, and they might not be interested in induction work at all. And
Right.
so I think, like for me, having like a separate service that's specifically called induction massage, like we have it as an add-on, like an optional add-on. So
Hmm.
clients can choose that if they want that. We have it starting at 38 weeks. We
Hmm.
make no guarantees. I think that these are all really important pieces for the ethics portion of it. Like, is it ethical to charge more for something if you cannot guarantee an outcome, right?
Right.
It's a gray area. I don't charge extra for induction work.
Right. Yeah, I don't
It's
either.
something, yeah, it's something to really think about, you know. Um, I specifically call it induction massage, but with the caveat that we cannot force your body to do anything that
Yeah.
it's not ready to do. But the induction really speaks to the intention of the massage, the
Mhm.
joined intention. Like, it's my intention as a therapist to help your body move closer to this goal, and it's your intention that this is what you're seeking out. Um, and so they're distinct from the labor work, which could start as early as 35 weeks, and the induction work, which we would start as soon as 38 weeks.
Mhm.
And again, like, in a perfect world, we wouldn't even need to offer this, but because we're having clients, right, who are saying, well, they're going to induce me at 39 weeks. I'm like, well, let's see if we can get you in a little bit before that and see what we can do, right? So
Yes.
that's where that timeline even comes from. And 38 weeks is pretty much considered full term. We have occasionally made exceptions for women who had like some medical reason for being induced at 37 weeks. I think
Mhm.
we chatted about this a little bit. Like, I feel like in every case in my practice so far that we've seen it, it's been for cholestasis.
Oh, okay. So I see it with IVF pregnancies.
At 37 weeks. Wow. Yeah, I've had a couple,
Mhm.
but that hasn't been super
Yeah.
common.
Yeah.
That's interesting. Yeah, so
And then gestational diabetes. Yeah.
mhm. 37 weeks is
Yeah, it's
it's a
happening
little
here.
baby.
It
Yeah.
is. Yeah.
It just makes me feel like, are we sort of having an unspoken epidemic of premature babies, right? It's a
I
it's a
think so.
huge adjustment for babies to transition from the womb world to the outside world. Um,
Mhm.
yeah.
So I had three full-term mamas yesterday and three this morning, and I think two of them were just didn't feel like they were being. I didn't hear them talk about being managed and like being pushed to
Mhm.
have inductions, but the rest of them were all having these really heavy conversations about like I'm at the end and they're gonna I've got like maybe another week. So yeah, it's just almost everybody here.
Yeah. I feel like it's very similar here in California too.
Mhm.
Yeah. Um, and you also have to walk the line of, is me contradicting that in any way actually helpful or stress reducing for her, or would that add to her stress, right? Because I certainly have clients who come in, right, and they're saying like they want to induce me, and it's like this whole like clear disdain for this idea, and like she clearly doesn't want
Yeah.
to do that. And those are the clients where I might be like, it's absolutely your right to
Mhm.
decline, to not show
Right.
up,
And
these are,
yes,
but at the
yeah. I
same
don't know if
time,
people know
like,
that.
yeah, and it's like I want to advocate, but I also really want to do it through the lens of like, is this information welcome? Is this
Right.
information actually going to reduce her stress? Because you also have clients who um, very much trust their care providers,
Yeah.
and anybody, even with the best intentions, who are kind of creating some friction between her and her care provider, it can cause an immense amount of stress for her.
Hmm.
And
Yeah.
so I really want to be sensitive to that and know, like, is that information welcome? Is it helpful? Is it
Is
going
it
to cause
kind?
her
Right.
more? Is it kind? Is it going to cause her more
Yeah.
stress? Because is she going to do anything different anyways? And again, like, we've mentioned this before, but like, if you're ever not sure, like, you can't unsay things.
Right.
And it's such a delicate time, pregnancy in general, but let alone like those, the last few days before meeting your baby,
Yeah.
such a sensitive time. So if you're
Hmm.
ever unsure, like, you can always ask a client,
Would you like more
would you
information or
like more
yeah.
information? Would you welcome, would you ever consider,
Hmm.
whatever.
Yeah.
Yeah.
Very
So
important.
yeah. Oh my gosh, we're at 1:36 already. It went by so fast. Of course this topic
I
did.
There was a lot to talk about. And I feel like we could have spent a lot more time on some of those little places, but yeah.
I know. I think we did. I think we did a pretty good job, but I think that just like a little mini recap of like the ethics, make sure
Right.
that you are describing what you're doing, that you have full consent from your client, that you don't make any guarantees or promises, because there is no magic button, right, that can start labor. Um, Consider whether it's ethical to charge more for these services, right? Neither one of us do that. Um, Make sure that she could change her mind. I
Oh
feel like
yeah,
that's also
absolutely.
really
Right.
important. Because I've had
Yeah.
clients who booked an induction massage and then they come in and they're like, for whatever reason, like, they're not ready. I'm like, no problem.
Yeah.
No problem. We can do
Yeah.
something else. Yeah.
Yeah, for sure.
I'm trying to think if there's anything else.
Mhm.
Hmm. Oh, I was gonna say too that with the induction points, don't cause pain. That's also, I think, unethical and not
Yeah.
productive, counterproductive, in fact, right?
Extremely counterproductive. We're not causing pain. No, we're working with her breath, her body. If something's super sensitive, you're gonna moderate your pressure to that. Yeah, very important. Oh
Yeah,
my
so sort of
gosh.
as a maximum,
Yeah.
these points might feel intense. They might take a little bit more of her focus, but they should never be painful, right? Because that's going to tip her whole nervous system into a sympathetic state, which is what we're trying to avoid. We want her to feel safe. We want her to feel relaxed. Um, I guess the only other thing that I think might be important to say on like the induction sessions and how they actually go is that I actually try and speak to my clients less if they're open to it so that they can go deeper during
Uh-huh.
the sessions and kind of get to that nonverbal place, that their limbic system, that ancient place, because I think if they can go there during the session, they're going to be able to access that better during birth. That's not always true for every client. Some clients need to offload some stuff, right?
Right.
But I kind of
Yeah.
follow her lead. I'm like, if I get any kind of inkling that she's like gonna relax and kind of be quiet, I will zip it and just let her
Hmm.
go there. Because I feel like getting
That's a
her
good
out
rule.
of getting out of her speaking place, that especially that close to birth, can be really helpful.
Yeah. Yeah, I feel like that's a good rule for us most of the time anyways, to follow their lead. Don't talk to your clients, don't talk at your clients.
Yeah,
You might need to ask them something occasionally during the session, and if she talks, respond, but don't continue a conversation. Yeah, those things are super important.
yeah, yeah.
Mhm. Yeah,
Beautiful. Well, is there anything else that you feel like you want to touch on for today?
I think we covered a lot of it. Yeah.
Yeah, if anyone else has other things to add, other questions after you watch the replay, feel free to drop them in the posts, and yeah, we'll be happy to answer them. And thanks everybody for your time.
All right. See you next week.
See you next week.
Bye.
Bye.